endometriosis not a hard disease to deal with financially? Because everyone is going to look at the financial part of it. Is it accessible? Can someone who comes from Jinja, Jinja is also near, from Deep Masaka, having such a problem, since our government hospitals such services are rare to find? How can someone access such a service with a fair pay?
What I would say is that the most important thing would be putting all the focus on prevention and catching these women early, because that is cheap.
Yeah.
We are trying to put the drive back to schools so that the bigger majority of adolescents who have these symptoms can be caught early. So we want the government to include sexual reproductive health, to include endometriosis and menstrual pain in sexual reproductive health. Right now the focus is more on reproductive sexual hygiene and that. We want them to include menstrual problems, so that the Metrons who are looking at these young girls, the school doctors, the teachers know when they see a young girl stuck in a sick bay during menses, it's a problem. So when we catch them early and we give them cheaper preventive drugs, like I told you, a pill is cheap. You prevent progression to complications. However, when they come to us or when they get complications, for example, if a woman gets infertility, it's expensive.
Yes.
You need to do IVF, and IVF costs over 15 million plus. That's expensive, and usually most of the time these are the alternatives they have. How many centers of IVF are there in the country? Less than 10. If they need surgery, and surgery is the only way, their pelvis is frozen, they have all these cysts, the intestine is affected, surgery might cost more than 15 million. And that's expensive. And not all people can do the surgery. It's an endometriosis expert who can do the surgery. And how many do we have in the country? Cannot even count them on one finger. So we want to avoid.
Before we go to the part of billing, your 40 years and things have really gone bad. So we look at the preventive measures early enough. We detect the disease early enough.
We see ultrasound, because ultrasound costs about 100,000, and that's affordable. So if a woman does it early,
do you think it's affordable?
It should be more affordable than the 15 million. Because we don't want to get you when you already have complications. So for me, the drive should be more toward the side of preventing progression to complications, by putting it out there to everyone that when you have a daughter who has pain having periods, bring them early.
Okay.
But for the women who already have the disease and it's complicated, it's not going to be easy, because there are very few centers in the country that look at endometriosis. When we started, it was almost only us here at Tenrob Hospital who started the drive, because we bothered to go out and look out for the skill and knowledge in other countries. And we have tried to train now quite a number of colleagues. I'm happy that now the knowledge is getting even into public institutions where it's supposed to be, so that the bigger majority of women who go there can also get some help. Maybe in the next 5 or 10 years we shall have better skills.
Actually, this thing has been happening for centuries. It's just that lack of information and knowledge that we have fallen prey of the disease. However, I think it is preventable, doctor. Yes, endometriosis, as doctor has explained, this is as a result of the hard menstrual pains. While you're young, it comes actually. So the peace that we normally have while we're young, we should not take them for granted. Let's detect the disease early enough so that we can prevent the 15 million that might come as a result of the disease when it has gone bad.